Hello and welcome to the program. Today I'm your host, Neal Howard, here on this Health Supplier Segment on Health Professional Radio. Thank you so much for joining us today. Our guest today is a man whose team helps people save money. Now, how important is that? Well, it's sometimes the most important thing, especially when dealing with medical bills. Our guest is Thomas Torre, the CEO of Copatient, who leads a team of patient advocates who are focused on medical billing. Healthcare finance management is fast becoming a major issue for many families, and Tom and his team are here to help individuals save money. Welcome to Health Professional Radio, Tom.
Thanks for having me, Neal.
Now, give us a little bit of background about yourself and how you came to be CEO of this company that's doing some really great things to help folks save money on medical bills.
Sure. Neal, I've been involved in consumer healthcare financial services for well over a decade. And what that really means is helping individuals manage their cost of healthcare. I'm sure it'd be no surprise to your listeners for me to say that the cost of healthcare is going up dramatically. And I just saw something recently, a statistic indicating that over the last 5+ years, the cost of healthcare has gone up 180%. Wow. So big impact on individuals, and the area that I've been working in for the last 10 or so years of my career is providing solutions that help individuals manage and understand and be able to afford the cost of healthcare. As part of that journey in my career, I ended up at Copatient just about a year and a half ago, and was very excited when I came across the organization because of the good work that Copatient is doing to help individuals manage their cost of healthcare. The big change that's going on in the market, Neal, is that it used to be in the United States that an insurance company, paid most of the cost of their healthcare. You would pay a premium, and then you would have minor out-of-pocket expense, but the insurance company paid most of your costs. Well, over the last, so many years, that has shifted, and now much of the cost of healthcare comes out of your pocket or my pocket in what's referred to as out-of-pocket expenses.
As far as the affordability of healthcare becoming, out of reach for many, many folks, aside from the fact, the higher cost of production of goods, prescriptions, all of that, what is another or a couple of other factors that are actually fueling this astronomical increase, this unnecessary increase in medical services?
Well, so you hit on one of the important things. That, of course, the cost of prescription drugs has gone up quite a bit, right? And that's one of the key drivers for the increases in cost of healthcare. Another thing that's driving up increasing cost of healthcare is consolidation in the providers that offer you services. Okay. So combined together, there's less choices in a geography, and like any other, supply and demand situation, when there's less supply to meet the demand, the costs go up. The third factor that's been impacting the cost of healthcare for individuals is this concept of in-network and out-of-network providers. It used to be in the U.S. that if you lived in a particular state, so I live here in Massachusetts, and if you live in a particular state, the Blue Cross Blue Shield, if that was your provider in your state, they offered a plan to you for your medical care. Every doctor that belonged to that Blue Cross Blue Shield in that state would be, available to you for you to go to get medical coverage and would be covered by their negotiated rates. Well, as time has gone on, the network concept has gotten much more complicated, and you might go to a doctor that belongs to your health plan's network, but that doctor may not specifically be in your plan. And so if you go to a doctor that's not covered by your plan, that doctor is much more expensive to you. It's out of network. It's not covered. It's a much higher rate. And the possibility of that happening has gone up quite a bit because of these new network designs, which are often called narrow networks. So those are some of the things, in addition to just the cost of healthcare going up, that have had an impact on people's cost of healthcare.
Okay, so those are some really mind-boggling things to think about, when you're thinking about paying for your surgery or whatever. Now, with all of this networking and in-of-network and out-of-network and insurance and co-pays and whatnot, doesn't the potential for huge mistakes exist with all of this data and information going back and forth to all of these different entities, let alone just you and your patient? How does your company navigate that aspect of it to help us save some money?
Yeah, so for sure, there's definitely a real potential for errors to be made. And in some cases, there's inappropriate behavior that is done by players in the system. But let's put that aside for a second and not just talk about that. Let's talk about mistakes that just happen, right? Okay. As you're aware, there is a complex set of diagnosis and other codes that are used by the industry to capture what you were treated for, what your illness is. Those codes go from the doctor's office, from their practice management software, goes through a clearinghouse to a health payer, and they analyze that data and they determine what they should pay. And it is very possible that there are mistakes in the codes that are selected. You could inadvertently be billed for procedures that you didn't have. You're at a hospital. There's a lot going on. There are things that you are being billed for that you were never really services you're never really provided. So there's this happens quite a bit, and our data suggests that it's probably somewhere around 80% of the time that there's one or more errors. I know. Public data that's available suggests it's even higher, around 90%. We haven't personally observed that, but the numbers can be very high because there's so much possibility for mistake because there is so much data that's required to process a medical claim and a medical bill.
Well, let's talk about the impact that Copatient has on its clients. What would you say you say about 80% of these billings are going to have substantial mistakes, money-saving mistakes once they're corrected. What is the average as far as savings, across the board on your clients?
Well, so, the average savings varies quite a bit depending on the situation. So, if somebody is out of network, we typically see a savings where we could, be over $2,000 is the amount that we could save an individual if they go to a doctor that is out of network. Now, that in that case, that's not so much an error. That's because somebody's being billed a much higher rate because it's not a lower negotiated in-network rate. Does that make sense, Neal?
Yeah, it does. It does. It does make sense.
Yeah.
Yes. Is the technology that you're using, is it seamless with providers as well as insurers? Or is it your technology, or is it something that you kind of piggyback on someone's existing data network?
So we built the technology ourselves. It's proprietary, and it's focused on enabling our consumers to have a great experience, for us to educate them and help them manage through the complexities of medical billing. So you would go to our website, you would choose to use our service, and there's one of two ways, that you would end up using us. One way is that you go online onto Google and you search and you say, I need help with medical billing. You find us and you come to our website and you decide you want to use us. You choose us, you set up an account, and you start to use us. The other way that you could land on our site and use us is that your employer offers our service as a benefit to you. Many employers understand that it is very, dealing with high medical bills is a big issue for their employees. So they provide our service to their employees to help them manage through these challenges. So you get on our website. We focused on creating a great user experience, allows you to upload very easily any data that you might have. We can also take in claims data from employers to look at claims data into our system, and all of that works very easily and seamlessly for the individual. Once we go through that process, we help the individual understand what may or may not be wrong with their medical billing. Our advocates then go to work inside that same technology, working with the doctors and the health plans to resolve those outstanding issues.
And give our listeners the name of that website, please.
Our website is copatient.com, COPATIENT.com. And one of the things that we really do, a way to think about this is we all go through life with a lot of different things that we do, but we're really not experts in it, right? I'm sure stuff comes up in your life day to day, that you're all of a sudden you need to be really informed in. Same thing that comes up, for me. And one of the things that we're not really informed about as humans is medical billing. Who pays attention to it most of the time, right? You get your medical bill, you wait till you get it a couple of times, make sure it hasn't changed. You look at your EOB or explanation of benefits. It all looked okay after a few times. You go ahead and make the payment. When that's a $100 office visit, that's not such a big deal. When you've been to an emergency room or dealing with an illness and that bill is multiple thousands of dollars and you can't understand it and you're not sure what you're being billed is appropriate, you then have to either have one of two choices. You have to educate yourself and go fight the fight if you need to, or you can turn to somebody like us who are experts at this, and this is what we do day in and day out, and we'll do we believe a very good job helping you, and then you don't have to become the expert, sort of outsource it to us, if you will.
Well, I'm certainly glad that you came in and told us all about Copatient today, Thomas.
Well, it was a pleasure to be here. Thank you for inviting me in. I've enjoyed speaking with you today.
Great. You've been listening to Health Professional Radio on this Health Supplier segment. In studio with Thomas Torre, the CEO of Copatient, who leads a team of patient advocates focused on medical billing. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download on SoundCloud.